Okay, so thank you for that introduction, and thank you for inviting me to speak here today. My objective this afternoon is to provide an overview of two major data resources that we have at USDA, both scanner data and the National Household Food Purchase and Acquisition Survey, and to dive into how we use these data resources to examine American food choices. But before I begin, the standard disclosure applies that whatever I say here today does not represent any official USDA determination or policy recommendation. Okay, so why do we need good data? Well, we know that diet is the primary contributor to poor health in the United States. We know that American diets are low in fruits, vegetables, and whole grains, and high in sodium, processed meats, and trans fats. And this is a figure from the Journal of the American Medical Association, and it charts the number of deaths related to 17 different risk factors in 2016. The largest risk factor was diet, which was associated with over 500,000 deaths. These diet-related diseases, in turn, represent an enormous and increasing economic burden. Medical expenditures and the indirect costs associated with lost productivity from obesity and being overweight is estimated to have cost us $1.4 trillion in 2014, equivalent to 8% of the US GDP, to put that in perspective. Additionally, federal healthcare spending continues to grow and now roughly represents 25%, a quarter of the overall federal budget. And at the same time, food insecurity remains a significant problem in the United States. In 2017, approximately 1 in 9 households were uncertain of having enough food to meet their household needs at some point during the year. So to alleviate the food needs of low-income and disadvantaged households, USDA administers 15 food and nutrition assistance programs, including the Supplemental Nutrition Assistance Program, SNAP, which was formerly known as the Food Stamp Program, the Special Supplemental Nutrition Program for Women, Infants, and Children, commonly referred to as WIC, and the National School Lunch and Breakfast Program. Spending for these programs totaled $96 billion in fiscal year 2018. So to address these adverse public health trends and to develop and administer effective policies, we really need quality and comprehensive data. Good policy requires good data. And for food and nutrition policy, this means data that helps us understand American food choices and the complex dynamics of food demand. So the first data resource that I'll discuss is scanner data. So for over a decade now, USDA has purchased proprietary household and retail scanner data from IRI, a market research firm. And the two primary components of these data are the household panel, the consumer network, and retail food sales data known as InfoScan. The IRI Consumer Network is actually a nationwide panel of over 120,000 households that provide a detailed account of their retail food purchases. The panel is selected to be demographically and geographically representative of the United States, and the data also includes survey weights so that we can produce national estimates. Households participating in the panel can either download a mobile application or are provided with a handheld scanner with which they scan the barcodes on all of the products that they purchase and then upload that information on a regular basis. On an annual basis, households also provide some demographic information. The other component of the IRI data, the scanner data, is the InfoScan data. InfoScan provides weekly transaction data from retail food outlets, including grocery stores, superstores, club stores, pharmacies, dollar stores, convenience stores, etc. These data include weekly retail sales data, so both revenues and quantities sold at the item level for every item. So as you can imagine, this is a very rich and large data set with over 6.5 billion observations per year. And it's estimated, or we estimated, that the coverage of food and alcohol sales in the United States within these InfoScan data are approximately 55%. So these data are used, as you can imagine, for a multitude of different projects, especially related to prices and quantities purchased. So for example, at USDA, we use these data to estimate the cost of fruits and vegetables. So in red here, we have the average cost of 62 fresh and processed fruits commonly consumed. So this would include both fresh apples and apple juice. And in green, we have the average cost of 92 fresh and processed vegetables in 2016. And so what the main takeaway here is from these authors is that fruit prices really ranged in price from about 20 cents to $2.50 per cup equivalent. And then vegetables, on the other hand, 3 out of 4 vegetables cost less than 80 cents per cup equivalent. But what about when we want to study how well these food sales and purchases align with dietary recommendations? That's not as straightforward as one might initially think. So consider, for example, an ultra-processed food product, a frozen lasagna entree item. In order to know how well that aligns with dietary recommendations, we would need to know the cup equivalents of vegetables, grains, proteins, and dairy within that entree item. But that's not available in the IRI data. That's not even on the nutrition facts panel. So to resolve this, a few years ago, USDA sought to match and link the scanner data to USDA nutrition databases, which would allow us to measure the healthfulness of retail food sales and household purchases. And if you've ever done any data linking and merging, you understand that this was an enormously complex task. We linked nearly 1 million food items that were reported, purchased, or sold in the IRI data to about 8,000 USDA food codes using both probabilistic and semantic matching. We tried to automate this as much as possible. So going back to my lasagna example, every frozen meat lasagna item reported in the IRI data was matched to a single food code, USDA food code, for lasagna with meat frozen. So there were some semantic differences that we had to account for. The other big challenge with linking these data is that scanner data includes the weights for food items as purchased. So this would include a lot of inedible parts, whereas the USDA food codes include the weights for items in their raw or their cooked form. And so without those inedible parts. So we also had to develop conversion factors that would really allow us to move between the two data sets. So I'm not going to go into any more detail here, but if you're interested in those details, a couple months ago, we recently published a technical report that outlines all of this methodology. And while we're on the subject, I just want to mention that over the past 6 months, we've also met several times with the USDA branded food database partners, including ILSI, for those of you familiar with that project, to discuss IRI data and these links and to identify ways which the USDA branded food database could leverage the IRI data and these links and vice versa. So having established these links, we can now assess the overall healthfulness of retail food sales using the IRI InfoScan data. And we score nutritional quality using the Healthy Eating Index, which summarizes how well a set of foods conforms to the recommendations presented in the Dietary Guidelines for Americans, or MyPlate. And the highest possible score is 100, indicating complete conformance with federal recommendations for 13 different dietary components. For the 9 adequacy components that make up a healthy diet, a high score indicates that Americans are purchasing sufficient amounts of those foods within those food groups. whereas a high score among the 4 moderation components indicates that Americans are keeping purchases of foods containing those components in check. So high scores indicate a better diet in both the adequacy components and the moderation components. So in total, retail food sales in 2013 scored 55 out of a maximum possible score of 100, far below federal dietary recommendations. And the component scores for whole grains and sodium were especially low, indicating that Americans are not purchasing enough whole grains and they're purchasing too much sodium. All right. So at this point, you may be asking, okay, well, what about all those other foods that are not from retail food outlets? What about those foods from restaurants, from work, from school, from friends and family? This is where FoodAPS fills the gap. So the National Household Food Acquisition and Purchase Survey is an innovative survey that was sponsored by the U.S. Department of Agriculture that collected nationally representative comprehensive data on household food purchases and acquisitions. Households reported foods from food-at-home retailers such as superstores, grocery stores, and even farmers markets, from food away from home establishments, including restaurants and fast food locations and schools, and then also foods obtained for free, so from food pantries, community centers, and from family and friends. So starting in April of 2012 and ending in January of 2013, surveyed households were asked to report all foods purchased or acquired for free at the item level over a 7-day survey period. Low-income households and households participating in the SNAP program were specifically oversampled to allow for research on the food behaviors of populations that are often underrepresented in other surveys. So specifically, FoodAPS was designed to provide nationally representative estimates for 4 target groups: SNAP households, non-SNAP households with income below the federal poverty guideline, non-SNAP households with income 100 to 185% of the federal poverty guideline, and non-SNAP households with income greater than 185% of the federal poverty guideline. So using a variety of survey instruments, including food books, scanned barcodes, receipts, in-person interviews, and telephone interviews, FoodAPS really collected a wealth of information. And to give you an idea of what was collected, at the household level, we have information on household income, composition of the household, food security status, diet and nutrition knowledge, and food assistance program participation. At the individual level, so for every member comprising each household, we have information on basic demographics, dietary restrictions, and whether a child attends school and which school they attend. For every acquisition event where a household member reported acquiring a food item, at least one food item, we know who made the acquisition and on what day, where the acquisition took place, the total amount paid if it was purchased, and that includes tax and tip, and how the purchase was made, that is using cash, credit, or SNAP food assistance benefits. And then lastly, for every individual food item acquired and purchased, we have a description of the item, quantity information, expenditures, and unit prices. So all in all, FoodAPS includes over 1,000 variables, which are described in detail in the documentation. Lastly, FoodAPS also integrated multiple types of information from multiple sources. It's not just a survey. That is, USDA merged and linked the FoodAPS survey data with other data sources to reduce respondent burden, because as you can imagine, this was a very burdensome survey, and to enhance data analysis. So these other data include food item descriptions from proprietary scanner data, the IRI data, USDA nutrition data from the databases, the same databases that we linked the scanner data to. Administrative records of SNAP participation, so we actually can confirm SNAP participation. Store and retailer location data, and then store characteristic data, so we know what type of store or retailer it was. And then lastly, food environment and food access data. So what have we learned so far about American food choices using these data? Looking at Calorie Sources, we learned that 3/4 of U.S. households' calories come from retail stores such as supermarkets, supercenters, grocery stores, small specialty food stores, convenience and dollar stores. These are the shades of blue. And then 17% of calories come from restaurants and other eating places. And then the rest come from schools, family and friends, and other sources. We also learned that all households, both households participating in the SNAP program and those that do not participate, usually bypass the closest SNAP authorized food retailer to do their main grocery shopping at another store. So this suggests that other factors, not just proximity, play an important role in where households ultimately choose to shop, such as price, quality, selection. One of the more interesting findings, at least in my opinion, is that free food is really an important source of food for many households and really shouldn't be overlooked. So on average, 22% of the times that households reported an acquisition event, they reported that that event was free. And then for SNAP households, the share of free food events was even greater, close to 30%. And the greatest share of free food acquisitions events were from family and friends and other social gatherings. Those are represented in orange here in this bar graph. Examining the acquisitions of SNAP households, we learned that SNAP households acquire about as many calories as other households. We can see that on the top half of this chart. But they spend less, so the expenditures are on the bottom half of this chart. So to do so, SNAP households devote less of their food dollars to purchases from restaurants and other food away from home sources, and instead rely more on free school meals and from friends and on friends and family. And then for at-home foods from grocery stores and other retailers, SNAP households may visit lower price stores, or they might be buying a different mix of foods to really stretch their food budgets. And again, just as we did with the IRI scanner data, we can also assess the overall healthfulness of household food acquisitions and how well they align with federal dietary recommendations using the Healthy Eating Index. And as a reminder, the highest possible score is 100, indicating complete conformance to federal dietary recommendations. So here we have total HEI scores for all food acquisitions all the way on the right. Here we go, yeah. And then also broken down by food at home and food away from home. For SNAP households in blue, lower income non-participating households in orange, and then higher income households in green. And I should point out that bold colors indicate that the difference compared to SNAP households is statistically significant. So as you can see, the food we prepare at home is overall healthier than the food we acquire for consumption outside the home. Though overall, the scores are still well below federal dietary recommendations. We can also break this down even further and estimate total HEI score for the acquisitions made at different outlet types. So for food at home outlets, on the right, on the left, large grocery stores, and this includes superstores and supercenters, are the most nutritious source of foods. And perhaps unsurprisingly, convenience stores and dollar stores are the worst. For food away from home, on the right, schools are in fact the most nutritious source of foods compared to restaurants and other food away from home places. We can lastly examine the different component scores of the Healthy Eating Index. And similar to the results from the retail sales analyzing the IRI InfoScan data, we see that again scores for whole grains and sodium were especially low and far from optimal. So as far as the key takeaways, this is stating the obvious, but both retail food sales and household food purchases do not align well with federal dietary recommendations. But more importantly, especially because this is the data age, I want to stress that both scanner data and FoodAPS data are truly excellent resources for researchers examining food demand and the different factors associated with food demand. And I've really only just scratched the surface here. There's so much more that has already been done, but there's also so much more that can be done with these data. So for FoodAPS, we're trying to keep track of the research on our website here, and we are currently actually developing a similar website for scanner data so that we can keep track of that research as well. It's not live yet, but we hope that it will be live in the near future. Thank you once again. I'm happy to take a few questions.